such a big amount. Now, what is also endangering our industry is the imposition of tariff. The original plan was 35% and retaliatory tariff of another 100, and then it went to 145. At the moment, it's at 10%. Why 10%? Because the 145% tariff is on hold for 90 days. It's like a scenario of good news. Oh, good news, there's no tariff. But the bad news is on hold for 90 days. So whatever happens in 90 days from now, it still be, if the imposition of the tariff is 145% or just 100% or 35%, we still get hit no matter what. I was reading if what I read is correct. The state had already passed 5 spending bills, okay? And one of them is the Appropriations Act, and that's where the figure for Medicaid is. It's almost below 1/2 of what it 2023 level. The budget shows that for Medicaid, it's $2.6 billion, down from $5.46 billion in the 2022-2023 level. And therefore, it's but out of that $2.6 billion, only $2.48 goes to Medicaid, for all the programs that is covered by Medicaid. The sad thing about this is we found out where the tariff was announced right after the session in the state legislature was almost winding down. So it was like too late to react. Okay? So when I went to Carson City for a couple of days to lobby with the state assembly and state senate, they were actually surprised that that's the first time in many, many years, or over 25 years, that there was a lobby in Carson City for the durable medical equipment. And Denis will be speaking later, actually helped me out. I was able to sit down one-on-one with the chair of the Health and Human Services of both chambers and the members. And I told them our concern that the only way we can survive is if the tariff is imposed, is for them, for the state of Nevada to adjust the rate on the reimbursement for medical equipment and supplies. That's why I called all the other stakeholders on this to get into this meeting, because group home owners are really concerned that they might not be able to get the supplies as usual. And then there are also the home health agencies and hospice that are actually, getting the same kind of supplies for home care treatment. They will all be affected. And I'm so glad one from the home health agency is here, Marjorie. Thank you for being here. She's with Vital Care, Home Health. And the possibility that that things are too late for us, because not only that the Medicaid funding is affected, it's statewide. According to analysts at the legislature, the revenue projection for Nevada in the next 2 years is way below the normal because of the economic situations due to the economic policies of the president that is hurting the state's economy. So we're bracing. We are all have to brace for this. But there is the only light of hope that we can long for is if adjust the rate in commensurate to the tariff or the price increase brought about by the tariff. And so, this can't be done unilaterally by Medicaid. There has to be some kind of we need representation from our state legislatures, and even some, involvement with the governor's office. So I was also I had a meeting with one of the governor's staff last week concerning our situation. It's a looming crisis, and I'm gonna have our official lobbyist, Denis, explain how things work in the state legislature. That's why I hired him to help me save the industry of the DME and supplies in Nevada. Mo, can you like to take the microphone?
So I think I've met everybody that's come in, although some just came in before. But I want to know from each one of you first, this will help me as I discuss with you. I want to know why you're here today. Tell me why you're here today. Tell me who you are.
Well, I've known Senator Mo from a long time ago. Actually, when we were joining AAG before, he's the first guy that I took a picture with, along with our former chair, who is joking. So I took over after him, and he passed away. Bless his soul. Anyway, my name is Juan Sunday. I'm the current chair for the latest organization of Care Home. We call ourselves Care Home because we care. We're commonly known as group home, but if you define group home is a place where two or more unrelated people live together. That house would be a group home. They don't care. We care. So we try to change that as well. We want to call ourselves Care Home. Anyway, the reason why I'm here is because of the fact that if Medicaid will be affecting 60% of our members in the industry, out of the 400 plus, are Medicaid through the We Are program, or the elderly, welfare for the elderly and adult residential care. If that would be the case, could you imagine 60% would probably go down as well. Given the data today, the number of facilities right now, actually we need 4 or 5 times more. And because of the fact that we grew so fast that we are competing with Florida and Arizona as a retirement capital for the whole country. And yet, the services that we have did not grow as fast. So we have a lot of retirees right now over here, eventually they need hospitalization. 70 to 75% of them, according to data, will not be able to go back to their own home. They need to have protective supervision. Our industry, the care home industry, is the only industry that can provide that. But the problem is, again, we don't have enough facilities. We need 4 to 5 times more. So what is the issue? The issue is, if this person is deemed ready for discharge by a hospital, a rehab, a skilled nursing facility, they need protective supervision, and they could not find one, and they could not discharge because that's an unsafe discharge. What about the next batch who needs that bed? And the next batch who needs that bed from the hospitals? So that's the dilemma we're in. But that's only part of the problem. The immediate problem is 60% of our facility can close down because of the lack of Medicaid. Okay, thank you very much.
All right, yes.
My apology, Mo, I didn't introduce you properly. Mo Denis is a former Speaker of the State Assembly. Majority Leader, majority in the Senate. Okay? So he knows the goings of the state legislature. Thank you, Mo, for being here.
Yeah, I did serve in the assembly, but I wasn't the speaker. I did serve in the assembly. I'm going to use this one to see if we can, I don't know how, if we can,
Yeah,
I can plug this one in. I guess,
Yeah,
you want to. Yeah, go ahead, stand so everybody can see.
Hello, am I
Is it, oh, you have to put it on.
It's actually live.
Is it live?
Yeah.
Okay, good morning, everyone.
Good
Thank you,
morning.
Good morning, everyone, and thank you so much for the invitation. My name is Tina Dorch. I am an employee of the Department of Health and Human Services, but I am a servant of the Office of Minority Health and Equity. It is a passion project of mine, and I want to just say I was so encouraged, Sam, to be invited, and even more so when I turned the corner and saw the senator here, because the senator has been a champion for these causes. Others have mentioned Joe Neal, and I remember people like the late Assemblyman Tyrone Thompson. Tyrone and the current senator, they've advocated for the office to stay in existence and to be relevant. And as a program in the director's office for the Department of Health and Human Services, we're missioned with making sure that all communities, no matter how marginalized or minoritized, are aware of these type of conversations. And why I'm here and appreciate this opportunity to share my mission and how it overlaps with today. There are so many individuals for whom chronic disease is a part of their life, right? Chronic disease is often, it often necessitates durable medical equipment that you cannot navigate the world. It maintains your accessibility. So there's an overlapping need and an understanding that I need to be able to relay when I am interfacing with the community at large. And so that is the mission of the office. We make sure that the communities who are most in need of this information are aware of this information. And I'm here to learn and listen. And I appreciate the opportunity, and Sam, you're in good hands with this particular senator. So.
Thank you, Tina. Before we go to the next, I just want to acknowledge the presence of Bo. Bo, he represents pharmacy, and then and also from the African diaspora. Yeah, thank you for being here.
Hi, good morning. I'm Marina Tinio, the widow of Joe Tinio. I'm here to continue his legacy in ECHO. We're here, I'm working closely with the chairman now, Buban, and I know the cost that my husband has put up, and I'm here to stay and support the Bubans.
Good morning, I'm Denis from Caramax Medical Equipment, and I'm here to just try our best to find ways to make or fix the reimbursement versus the tariffs that are increasing prices, and we're praying that it won't get too crazy. And I thank Mr. Sam for putting this together, for your persistence in inviting us. Thank you.
I'm gonna try to see if I can make that long.
It's not long enough. You probably have to go stand in front. Just kidding.
Oh no, stop doing something. I thought you were saying something to me. Oh no.
Hello, everybody. My name is Thor. I'm with Amateur Medical. And first of all, I just want to thank Sam for coming out, gathering kind of everyone together to come do this. But I think all of us are here today to see what information we kind of get on the tariffs. We don't know. I think you said for 90 days. But ultimately, it comes down to reimbursement rate. If the rates don't match what we're paying for the supplies, we'll all kind of have to go out of business one way or another. That's the main reason we're here. Thank you.
Good morning, everyone. Thank you, Sam. Thank you, everyone, for being here. My name is Mokro Taymor, one of the owners of Total Infusion Care, home infusion pharmacy. So we provide nursing as well as, infusion antibiotics. Mainly the theme that I want to bang away to help everybody out here. I don't know if people saw the article in the RJ, it was 1 or 2 months ago. Not just about the tariffs, but 28% reduction in Medicaid funding for the state. I believe there is a solution around it. Yeah, it's obviously a lot of political red tape, but it's about efficiency, outpatient services versus inpatient. All those dollars are being wasted on the inpatient side. If we can maximize the outpatient dollars, obviously, there's a $4,000 or $5,000 stay per day in the hospital, as opposed to the rest of us doing it for hundreds in the inpatient side. There won't be any cuts necessary if we are efficient with the funds that we currently have. So that's a theme. I know it's conceptual, but it makes sense because it's out there, and we know that Canada and the European countries have done it, promoting outpatient, and that's something we need to do in this state and help prevent all of us from going out of business and increase reimbursement. So hopefully we can discuss that more. Anyone else?
By the way, I like your name.
Oh, I like yours too.
I thought I was seeing double.
Good morning, everyone. My name is, hi. Hello, I know most people here. My name is Giselle Trinidad, and I am here to represent our pharmacy. We have a pharmacy, it's called 986 Pharmacy. We also carry medical equipment. So we're a specialty pharmacy, retail and specialty, so we take care of patients directly and also patients that live in group homes and assisted living facilities. I also represent, I'm a CHW, so a community health worker, so I represent a lot of patients that yes, me too. It's like a calling, right? It's never a job, it's more like a mission. So I'm here because I do want to get the right information because it will help me, it will equip me better to help my patients get the right resources. Thank you.
That is an important pipeline of information.
We are feeding companies.
You left me.
Well, if the cuts continue to happen in POWs.
Good morning, everyone. I'm Dr. Susan Fong. I am here representing Adolph, with the African diaspora. So I'm with the medical team. It's so funny because they sent me out here, and I'm the clinical director for Zig Medical. So we do psychological. So we do a lot of community work. We do housing too. So we get to meet all these challenges. So it's just great to be here to just get the information because we have team members, supporters, or group members that own businesses. We have 2 medical supply members that could not be here because they're in Carson City right now. But whatever information I can take back to them, I'll gladly do so. Thank you.
Thank you.
Thank you very much. Anybody else that?
Hi, good afternoon. I'm Marjorie Lindsay. I actually represent Vital Care Home Health and soon to have hospice and palliative care. And thank you, Angkasa, for inviting me here. I'm actually here for the purpose of supporting the businesses and also our business partners with healthcare industries. Thank you.
Great, thank you. Anybody? Did we miss anybody? Okay, so we've got a wide range of different folks that are all have one similar interest is to provide, you will provide good health care in your various capacities. So let me talk a little bit about the legislative process. And this is why this is important. These kinds of meetings are important because, one voice can make a difference. But when your voices all join together, it makes it even bigger. Because it's like, 1 plus 1 by itself is 1. But 1 plus 10 is actually more than that because your voices become 100 or whatever. And so right now we're currently in a legislative session. The legislative sessions run for 120 days every other year. And they do the budget for the state, and they do any policy changes. So, you know, when you talk about healthcare, the budget for healthcare is being decided upon right now, right? Nothing's been finalized yet because they have to go through all the budgets. They know how much money they have. That's determined December 1st, and then they update the number on May 1st, which they just did. The numbers changed by $190 million between December and May, as far as $190 million less than what they thought they were going to have when they projected it in December. So, but still, it's still about a $12 billion budget. And there is a fully funded rainy day fund, there's a couple of them. The total is about 2.6 billion. But because there's so much uncertainty going on right now, they're being very conservative in how they're doing budgets. And there's probably going to be, even when they have to finish in 120 days. So the first Monday, which is the second of June, the first Monday in June will be 120 days. By law, they have to finish, and they have to finish with a balanced budget. And right now, what they're doing is cutting any capital type things. So, like if they want to build a new office building, or like the university system wants to add, those kinds of things are being cut. Everything else, they're trying to get people to reduce what they need, right, so that they can balance the budget. And because they don't know what's happening with the federal government, what will happen is they're going to finish in 120 days. They're going to, but more than likely they're going to have a special session, probably in October, maybe in August. But whenever the federal government, when that becomes clear what they're going to do, they're going to have a special session. And so right now, to make adjustments to the budget, it's getting difficult because we're down to 11 days left. However, Sam did come up and you know, told some folks what's going on, and so they're aware of that. But you know, they're still trying to balance budgets, and so somehow that especially with what's going on with the federal government, if nothing happens right now on the adjustment, there is a bill to adjust the Medicaid reimbursement, and they're looking at some of that, right? But if it doesn't solve the problem, when they come back into that special session, that's when you need to make sure that they know what's going on, so that's included. Special sessions are either called by the governor, or 2/3 of the legislature can vote to do a special session. More than likely, it's going to be the governor that will call a special session. So letting the governor's office be aware, and as this was mentioned, he's met with some staff at the governor's office. We need to continue to talk to them between now and the end of session, and so that any adjustments that need to be made, we can make sure that they can look at that, and when they go to the special session, they'll look to see, the unfortunate thing is we don't know if that's going to increase funding from the federal government, or if it's going to actually decrease. And right now they're going based on what they think is going to be, the money that they get from the federal government for healthcare, for example. And if that somehow comes in less, they have to go into a special session to adjust the budgets, because they can't just, in the interim, just change things. They have to actually be in a legislative session, so they do a special session. And in this particular session, it's been a little different, because from the very beginning, everybody knew that there wasn't going to be any extra money. 2 years ago, they had a lot of extra money, and they did what some people call a Christmas tree bill, that helped to fund a lot of nonprofits, especially that provide different services in our community. Right now, that's a big issue. We've had meetings here with United Way. United Way is one of our clients as well, and they help a lot of nonprofits. They've had meetings here, and a lot of the nonprofits are worried because a lot of that federal funding that they use to provide services has been held back, and they don't know if they're going to get it back. So that's it's a challenge, but it also gives nonprofits an opportunity perhaps to go and try to fund some things through the community and other that might give incentive to those that get to that. So, Sam, what is there? What specific do you want me to cover? Right. One of the things that is very important, when he came to us, we asked, well, is anybody else working with you on this stuff? And he says, well, I'm talking to folks, but we're not together yet. So one of the things that's important is you guys as a group can come together, because your voices together can really make a difference. And you know, Sam can make phone calls to people, but if you all together are calling and talking to people, that they'll realize that there's an issue. Especially your own legislative person, so your own assemblyman, your own senator. If you don't have a relationship with them, you need to be working on that. This whole issue of healthcare and funding, this isn't something that's going to be resolved right now. It's a long-term issue. I always look at the legislature as it's a marathon, not a sprint, right? And so you have to build, and the main thing about the legislature, where you can pick up the phone and call someone and say, here's the, and then, when you have, as a senator, if a person called me that I knew, known, and had good relationship with, called me and said, here's the problem, I would believe that, right? As opposed to just some random lobbyist or somebody calling me and saying there's a problem. I have to do a lot more work to know if that's true. You know, if I don't know them and I don't trust them, I'm gonna have to do a lot more work. But if it's somebody that I trust, they come to me and say, here's your problem, I'm gonna believe what they're saying and try to find a solution for that. And so that's the one thing about legislators, is that, those relationships are real important. Because if, as a group, you realize there's a problem and say, we need to talk to the chairman, and the chairman he's your senator, right? You should be able to pick up the phone and call them down with a constituent, and they'll talk to you, right? If a constituent called me, I always took phone calls anyways, but especially if a constituent that one of my folks that I represent, I would definitely do that. And most of them are that way. So I think this is important. I think the reason this meeting is important so that you together can figure out a way that you can work together to have your voices heard, because it affects your businesses, but it also affects all the care. It affects the data. And the one thing that I always hate is when all of a sudden there's this urgency to fix a problem, and people say, well, we've been telling you, but they didn't take it seriously, and now all of a sudden it's a big problem, and trying to fix it, and some of this stuff is not done fast. You can't move fast, right? If it doesn't get fixed right now, unless it gets fixed in a special session, you got to wait a year and a half to bring back a bill. But you should be thinking a year and a half in the future, because there are some issues in your industries that need some help, right? And so now is the time to be thinking, in addition to all this immediate stuff that you have in plans, and be thinking, how can we fix this? And during the next interim, after the session ends, be thinking, what kind of things can we do? What kind of bills can we do, or what can we support? So that when the next session comes, you're ready to hit the ground running with legislation, or at least support for bills that are out there. So I think I'm going to stop there for now. And do you want me to see if there's any questions?
We can do a Q&A.
Yeah.
I do have a question.
Okay. Yes.
So I'm very new to this, I guess, lobbying and all that stuff. So will there be even a one-pager or something that we can all have the same information all together? What are we lobbying for? And so that way, when we go to our connections, then we speak the same message.
I was going to piggyback on that.
Yeah.
If we can have a script, because consistency is key.
Right.
If we are speaking about the same issues, and if we can have a list of the people that we need to call.
Right. Yeah, so those are all important issues, and I mean, that's exactly what we do with our clients. We have a message, and everybody. So when you go and talk to legislators, I mean, at this point, it's kind of late in the process, to do the normal legislative stuff. Because you've got to set up appointments to go, you know, and you know, you have to go up there and do that kind of thing. But as far as a one-pager, Sam put together a one-pager that has some things in there. He can share that with you. And if you need to make adjustments based on, you know, because he's basing it on the information that he has. That's important, because then you can just, even if you can't give to a person, that's something you can send to them. We did share that one, what he has, we did share with a lot of the legislators that we had an opportunity to talk to. So yes, very, very important though, that you all say the same message, because if you come in and say, here's the problem, and the next person comes in, here's the problem, and it's a different thing, then confusion is one way to kill a bill. If you can't understand it, if it's not simple enough to understand it in like a minute or 30 seconds, you know, it's very difficult, because legislators have 1,000 bills that they gotta, right? And so if it's complicated, yes, you gotta make it simple. Yes.
I had a short-term intermediary and long-term suggestion for consideration, and the short-term was absolutely about the talking points and keeping them up to date. Also under short-term, this body, as individuals, you are still absolutely entitled to attend committee meetings that are going on and speak under public comment. And your friend right now is the tool we call Nellis, and a certain senator can tell you more about Nellis and how to kind of navigate that pretty quickly. Also during the intermediary phases, I would recommend just attending the various advisory committees of state agencies. There are so many, or joining. You can check on the state's website to see how you can become appointed to a board that might be of interest. And then long-term, the senator is right, your voice is so powerful to even form an alliance. The alliance during next legislative session could have a durable medical equipment day where you are on, you know, when you're in Carson City and you have an audience and it's on the calendars and things of that nature. So I just think short, medium, long term, that's how my brain works. And it sounds like they're already on their way. And I would just be happy to then promote the materials and ideas that you have come up with collectively.
And if I might add to it, this doesn't end here. I volunteer to be your convener. If you have issues that are pressing, you know, I will notify all of you, and then you know, I will also be able to provide a unified message. And here's one thing that, you know, there's going to be another election next year. Okay? So the state legislature are elected every 2 years, just like Congress, the House of Representatives. One thing you can do that Joe and I have been doing since 2008, whenever there's like I get a call, hey Sam, would you be able to come to the, you know, to a mixer of Assemblywoman Selena Torres? Joe and I would go. The effect of that, if you keep doing it, you become familiar to them. This is more, I would say that, yeah, I'm a constituent that's familiar to me. I have to call him back or call her back. And not only that, it's like the effect of that. You know, when I went to the state legislature, I meet these people in the hallway, and they all know, you know, most of them know, Sam, what are you doing here? You're lobbying now? It's like, yep. I need help with these things, you know. Now we're smoking with Denis and Marco Roda, and even Senator Melanie Scheibel, like, as soon as she came out of the session room, hey Sam, what are you doing here? Okay. So it's like, I will be inviting you guys, okay? Whenever they get a call, I get a call, hey Sam, you know, I'm doing this and that on you. This election cycle already starts in July. That's for next year, okay? November election. Be there, okay? Show your face, get known to them, become a familiar face to them. And it's easier to approach them. Comes the next session after the 2026 election. So best thing is if you could help the candidates. Okay, it doesn't have to be much. That's why you write a check if they say, oh, can you come to my fundraiser? Can you bring some people? It's like it doesn't matter. You get $50 check, $100 check. You get in, you become part of their list. Oh, call them about this and that. So when you call them, you get they get to return your call because they know you're like a supporter or a donor, okay? And that is why it's essential. One of the things that Pure Medical has been doing is every election cycle, our company has a budget for election. That's part of lobbying. And that's how companies operate. They always have budget for government or legislative affairs. So it's one thing that you should talk among your management, your owners, that we need a budget for election. And you can not only that, it's like it doesn't matter what side of the aisle, okay? Write something, like send them donation. Because you get attention from both sides. that's what I do. That's what Joe does every election cycle. So and then it's like imagine this, Joe, Senator John also from Georgia, dropped by for like a half a day in Las Vegas. Who did he call to have lunch with? Joe. Hey Joe, you have lunch with me tomorrow? It's like I'm dropping by in Las Vegas. It's a U.S. Senator from Georgia, because he is on the list. He's like the list of donors. And he probably only like 2 people from Las Vegas actually contributed to his campaign. So he said, can I take my dad along? Of course. So we had lunch at the Paris, restaurant at Paris Hotel Casino.
It was at the Four Seasons in
Oh,
Mandalay
Four
Bay.
Seasons? Oh yeah, at the Four Seasons. So you need to be conscious about these things. We're in the education process. So these things, you can call me, ask me about it. I'll be glad to share with you how to navigate building a relationship with your elected officials. So it's important that you also incorporate it in your budget, annual budget. Every election cycle, set aside an amount for that. And that's why whenever I see them in public places, at the legislature, they say, hey Sam, you're not lobbying too? I said, no, there was never a lobby for medical equipment and supply. And I said, there is now. We're trying to save the industry. Thank you, Mom.
Yeah, so I just want to, real quickly, Sam talked about what he does, right? He hired us to help him, but he can only do so much, right? As an industry, if you want to do more, you got to come together so that you can have somebody there for you all the time and that kind of thing. Sam has had us do some things in the last little while, right? But it's true. I mean, just getting out and doing some things in the community, meeting your representatives. Even you go to fundraisers, they have fundraisers, but they also do community events. So legislators are out there. If you're out there in the community, you'll meet them, and they'll see you out there. They'll see that you care. That's important, because when you then come talk to them and say, "Here's an issue," they're gonna, believe you, and they're gonna work with you and try to find a solution to that problem. And then you also want to make sure you have someone that can help you to strategize, because you may have a legislator that really wants to help you, but that particular person, if they were to bring the bill, would get killed like right away. So you probably won't want them to bring your bill. You want somebody else. So you have to strategize. So but if you can come together as a group, you can set your priorities and then work to have somebody help you do that. A lot of the kind of stuff that we do, you can have someone help you and do that. But you got to come together. Any other questions?
Okay. What I see as the, if ever the tariff will be imposed, hopefully not, we're all praying for it, will goes up bigger. At 35%, we can barely survive. We will survive, but barely. But if it's going to be more than 35%, our profit is flushed to the drain. But somebody told me that, in one of my meetings, that if the worst scenario comes, the special session, that's the place where the governor's office, the state legislature, the director, the administrator for Medicaid have to come together and find the fund. And there is no more fund to be found except the emergency fund, the state emergency reserve. And that's like in the worst scenario, if we really get hit and the program had to survive. Medicaid, or all the parties, the governor's office, state legislature, and then the administrator for Medicaid may have to tap, they will, as the worst, and tap into the emergency reserve. Hoping the next year will be better revenue for state of Nevada. But I'm still, we're all praying that doesn't happen. That the tariff, we just cap at 35%. We can work with it, I think, at 35%. So that is, where we stand right now. As Mo said, it's remain united in this effort to get our voice heard. Because finally they are now listening to us. When Stacy Weeks, the administrator, came to Las Vegas last week, the governor's office staff, Sally Ginoya, told us, she was just here this morning. I was talking to her about you and the industry, about the crisis that is looming. So, thank you all for coming here, and then I will be in touch. And if you haven't put your cell phone number on when you register, because I'll be in touch with you whenever something is happening, and I can update you. Yes, Mindy.
Mr. Sam, I have so many questions.
Yes.
But first thing in my brain is that, where do we go? It's amazing what I heard. I thought this was just going to be, I just had to show up for my brother, but I want to move. What can we do next?
Yeah, okay.
And how feasible is it for us to be successful in our efforts? Because I do understand the legislative process and all that, but is it a reality that we can practice? That someone's going to listen to us?
That's, Mo, what do you think? Because I have my own mind.
So, I mean, it's kind of like, it's not a quick answer. One answer is you have to continue to try to fight now, even though, it's really hard when there's only 11 days left, because they've already finalized some budget things to try to open those back up. Sometimes it's difficult, but it just, it's something that you still need to try to do. And then you need to continue so that if there is a special session, there is gonna be one. At some point when they figure out the federal thing, the other part of this is we're talking about the state government here, but one of the other things that we had talked about is sending stuff to our federal representatives, our Congress and senators, because, they control the budget that comes from the federal government this year. Make sure that they're aware of the issue as well, because I think the most important thing right now is that they need to know what's going on. So when they're having discussions with, like, Stacy Weeks in here in Nevada, it's important for them to understand this issue, because the legislator's gonna ask them what's going on, and if she doesn't know, she won't be able to answer. So yes, I mean, you have to try to do something, and then you have to continue and not just stop, but I mean, continue through the interim. As he mentioned, there's gonna be, committee meetings on the interim Health and Human Services, or the Health Committee meets during the interim. Every committee meets during the interim, but they're combined, Assembly and Senate. And they're gonna talk about they're gonna talk about what happened in the session, and then they're gonna talk about what are we gonna do for the future. That's where you wanna be, because you wanna be giving comment that says, hey, we need to change this. And then that committee can then say, yeah, we're gonna do a bill on this next time to increase or whatever, right? So I mean, there needs to be that process, and then you need it. So as Sam mentioned, this is an ongoing thing. It's kind of like homelessness. You're not gonna cure homelessness, right? But it's something that you've got to find solutions and continue to then do those things. Or mental health. Mental health, you don't cure it, you have to treat it and then help people. This is a similar thing. The legislative process is something that you need to just continue, and don't just, because if you stop and start stuff, it makes it harder. But if you're all along doing stuff, and people know who you are, they call you. When, if a legislator wants to know something on your industry, they're gonna call you and say, what's going on, right? So I think that's the important thing.
Ms. Mimi, one of the very things you all can do, this is a bad habit of many Filipinos, including me, okay? They don't vote.
Don't vote, yes.
No, I voted.
Okay, 30% of them is like the top, okay? And this is easy to catch, okay, who voted and who did not. If you ask them, who's your assemblyman in your area? Who represents you? Who's your congressional representative? You didn't vote. They say, oh, I voted. You didn't vote. If you didn't know who you're... Yes.
Well, one of the things that legislature we always get, somebody always says, yeah, I voted for you. I go, where do you live? And Henry said, no, you didn't. I represent Los Angeles.
I didn't vote for you.
This one, it's actually like this. Start working on a list, like a little piece of paper you put in your refrigerator or in your office or thin board. Who are my representatives? My legislature, your congressman, in your district, your state senator, your state assembly member. Who is your commissioner? Clark County commissioner. Most of us live outside the Las Vegas incorporated area, so we don't get to vote in city elections. We vote for the county. Like, for example, I'm represented by Justin Jones. And if you live up north, you're probably in William McCurdy district. If you're in the central Las Vegas, you're probably in Pixie. So, all these things are important because when you, I am going to, one of the things we can do, I want all of us to be able to write to your state legislative representative and also in Congress, and then it's like a template letter, and just put who your, your representative is. If you are in.
Don't do a template one. If you do personal ones, they read those. The template ones, they don't read. Yeah, if you just put your name.
Just the gist of what.
Yeah.
Right, if you tell people what you want and give them a sample, and then just kind of do it in your own words, they'll read that.
Mr. Sam?
Yes.
I'm sorry, you started this, and thank you again for doing this. So, like what this, Senator Mo, passionately told us to create an alliance, and I think we should do that. And when you started,
Yes,
we'll
I
follow,
can.
we'll
Be glad
support,
to,
yeah.
because I 3 times I have made a phone call and a message with with Rich Poseski in NAPS, Nevada Association of Medical Providers and Suppliers. 3 times I left a message, never called me back. And then I finally, when he emailed me about what's going on the bill sponsored in Congress from an Iowa Democrat and a New York Republican, I said, what am I starting? because NAMPS, they only do federal lobbying, okay? And they're not actually the one doing it. It's funded by BGM, the funding company. That's why Greg Gallagher, their lobbyist in Congress, is actually not hired by DNA providers, but it was hired by a funding company to protect the DNA business. But we can, form a alliance, and then we will have one voice, and it's we're gonna be called alliance because we're gonna also involve, the community, minority communities, different healthcare providers that are affected by that.
Tomorrow, today?
I can get it done by Friday.
So two things.
I mean, if you're talking about the formation, we can do it now.
I just wanted to circle back to one of the earlier questions about what can you do right now. The session is not over yet.
It's
Right.
It is not
11,
over yet.
11 days, and that's like a lifetime.
We have 11 days, and there are critical hearings that are happening. Now, they're usually during the workday, and a lot of the average James and Joes can't be there. But you can join virtually, and there is a public comments portion. Whether the alliance is created or not, as an individual, personal commentary, Senator, carries weight.
Right.
And our elected officials, God bless them, they're taking on this mission, this mantle. They're not professional politicians. They're there 120 days every other year, and most of them have day jobs. Most of them don't have staff. They are doing a lot of this on their own. They need subject matter experts to provide personal testimony during public comment. And part B of that is what does remain through the interim, in addition to interim committees, is the Legislative Council Bureau. That is the professional staff that does write a lot of the bills. And as everyone has said, when you go on record as a public person giving testimony, they take note of that. And they may circle back to you to become part of the development of a new bill or for subject matter expertise.
Right.
So I'm just saying during the interim, these next 11 days, and during the official interim between the next session, take advantage of attending these meetings and speaking up during the public comment phase. And usually committee meetings, if you can't stay to the end, because sometimes they can run long, they usually have two portions. The beginning of the meeting starts off with public commentary, and it ends with public commentary. So I can't stress that enough, and Senator can tell me that I'm off too here, but I think that information does carry a different kind of weight.
Right.
And you don't have to go to Carson City
No.
to do this. There's
Yeah.
a legislative building
They
here.
also-
You can do
they-
it virtually.
Well, you can call them by phone, but they also have offices now over by the airport. They have hearing rooms over there, and you can go. And,
By Bermuda, Warm Spring access. There's a
But-
legislative.
but the other thing is, the two things that you really need to be successful, you have to have people in the alliance that are willing to do something, not just let Sam do everything. And you have to be willing to put some money into it so that you can have the kind of help that you need, right? I mean, the folks that are very successful, many of them is because they have folks like us that represent them and they can keep track of stuff, right? So you have to be willing to do that as well, right?
Yeah, and then maybe we can call our group, the Alliance of Medical Providers and Suppliers, which will include the community. We'll call it like stakeholders, medical equipment and suppliers.
Dad, Brazil Authority asked you which one, is it NAMS or NAMPS?
NAMPS.
What does it stand
There
for?
are actually
National-
two meaning of NAMPS. Our local is Nevada Association of Providers and Suppliers.
Medical Providers and Suppliers.
Nevada
But
Association.
then there's also
Nevada
National
Association of Medical
National
Providers Suppliers.
Association of Providers and of Medical Providers and Suppliers.
And suppliers.
Because N and national is one letter.
So,
Yes, ma'am.
Sam, have we presented a compelling catastrophic scenario where not only this industry would be affected, but the ripple effect, so there's more weight?
Yeah, in the letter that all that they all read, calculated were real, like real estimates. Here is what it costs now according to MSRP. This is the Medicaid reimbursement. Here's what it's gonna cost once the tariff is imposed.
And the number of positions, most more positions the state will be.
Seniors and disabled was one of the talking point. Because even the minority party members, the Republicans, the House and Senate and the minority, they were also concerned. Remember, I think it was Brian Tibbetts, or it was Gregory Well, I have a lot of, more than half of my constituents are seniors.
We received a letter from NAMS, but it's primarily for Medicare,
There's
so
for
they're,
Congress.
they're not touching.
Yeah, I was
Medicare.
hoping they were gonna get involved, at the state level,
Yeah.
but, I don't know, Richard Buzeski, he's getting too old. He has been there since I know him, in 2008, when we became operational at Pure Medical. It's already Richard Buzeski. He was already old at that time. I even looked at the obituary. Something happened to him, because he didn't call me. I said, and then I keep getting no obituary of Richard Buzeski. Because I know when at the last BGM conference, which many of us were there, including maybe you were there, like 4 from CareMax. He was still there, like, on the side. But I said, maybe something happened to him. So I looked on the obituary for Las Vegas. So yeah, it's, we're going to, would you like to be the vice chair? I'm the convener, or you can be the vice chair, maybe.
How much?
No, you actually have to pay in. You have to pay in to be.
Yeah, how much do I need to pay in? Yeah, we can